for today we'll be discussing the cardiovascular physiology, and our topic is the cardiac cycle. There you go. The cardiac cycle has 7 phases. So we have the first phase, which is the atrial contraction or the atrial systole. Second is the isovolumic ventricular contraction. Third is the rapid ventricular ejection. Fourth is the reduced ventricular ejection. Fifth is the isovolumic relaxation. Sixth is the rapid ventricular filling. And the last one, 7, is the reduced ventricular filling, which is also known as the diastasis. So for the first phase, which is the atrial contraction or atrial systole, this occurs during the distal third of diastole, and it is preceded by the P wave, which has electrical activation of atria, or where the atrial depolarization happens, and it contributes to, but not essential for, ventricular filling. So atrial contraction increases the atrial pressure, the ventricular pressure, as well as the ventricular volume. And in the atrial pressure curve, also known as the venous pulse curve, we can see there the A wave. And the heart sounds that can be heard at the atrial contraction phase is the S4 or the fourth heart sound, and it may be heard due to atria contracting against the ventricle. The ventricles which are stiff. So example for this one is for the patients with left ventricular hypertrophy, where we can hear the S4. And the S4 is not audible in normal adults. The other condition that can be found during the that can be heard the S4 is the atrial fibrillation, and it is most likely accompanied by increase in left atrial pressure, as well as in ventricular fibrillation, which leads to the fatal arrhythmia. So for the next phase, we have the isovolumic ventricular contraction. So this begins after onset of the QRS wave, and this QRS wave has electrical activity or activation of the ventricles, where the ventricular depolarization happens in the QRS wave. And during the isovolumic ventricular contraction, the ventricular pressure increases, but it is less than the aortic pressure. And the semilunar valves, such as the aortic and the pulmonic, are still closed. The blood will not flow from the left ventricle to the aorta due to the semilunar valves that is still closed. And the ventricular volume during the isovolumic ventricular contraction remain the same. And when the ventricular pressure is greater than the aortic pressure, the AV valves, such as the mitral and the pulmonic valve, will now close. And the mitral valve closed before the tricuspid. Okay, so again, the AV valves, such as the mitral and the tricuspid. Forgive me, a while ago I said it's pulmonic. Pulmonic is a semilunar valve together with the aortic valve. So the AV valves, such as the mitral and tricuspid valve, will close when ventricular pressure is greater than the aortic pressure. So this is during the isovolumic ventricular contraction. And the mitral valve closed before the tricuspid, and the first sound or the S1 may be split. So remember that during the isovolumic ventricular contraction, what heart sound we can hear is the S1 or the first heart sound. And what we can see in the atrial pulse curve during isovolumic ventricular contraction is the C wave. In contrast to the atrial contraction, what can we see in the atrial pressure curve or venous pulse curve is the A wave. Here in isovolumic ventricular contraction, C wave can be seen. The next phase is the rapid ventricular ejection. So here in this phase, atrial filling begins, and the ventricular pressure rapidly increases and greater than the aortic pressure. So during this phase, the aortic valves or the semilunar valves opens, and the blood will flow from the left ventricle to the aorta. And this will cause the ventricular volume to decrease, and most stroke volume is ejected. And the onset of the T wave, which represents ventricular repolarization, marks the end of both ventricular contraction and rapid ventricular ejection. So during ventricular ejection, the pressure difference is smallest in magnitude between the left ventricle and the aorta. The next phase is the reduced ventricular ejection, where the T wave occurs, and what happens here is the ventricular pressure, the ventricular volume, the aortic pressure decreases. So this is like the opposite effect of the atrial contraction, which atrial pressure, ventricular volume increase. In reduced ventricular ejection, the three of them decrease: the ventricular pressure, the ventricular volume, and the aortic pressure. So the aortic pressure decreases because of the runoff of blood from the large arteries into small arteries. And in this stage, in this phase, in the reduced ventricular ejection, the atrial filling continues. So for the next phase, it is the isovolumic relaxation. So after the reduced ventricular ejection, we have the isovolumic relaxation. So the ventricles repolarize is already complete. So repolarization of the ventricles is complete, and this is the end of the T wave, the isovolumic relaxation. And the atrial pressure curve, or the venous pulse curve, the V wave can be seen, and the ventricular pressure during the isovolumic relaxation decreases, but greater than the atrial pressure. So here, if the ventricular pressure decreases more than the aortic pressure, more than the atrial pressure, so the AV valve will close, and no blood flow from the atria to the ventricles. The ventricle here during the isovolumic relaxation remains the same, but when the ventricular pressure is lesser than the aortic pressure, then the semilunar valve will close, and the heart sounds that can be found in isovolumic relaxation is the S2, or the second heart sound. So we have the physiologic split 2, and this can be heard during the inspiration. And the aortic pressure curve, so we can see there in the aortic pressure curve is the dicrotic notch, or what we call the incisura. So the dicrotic notch occurs after the closure of the aortic valve, and it is because the vibration in the aorta near the aortic valve, causing the slight and transient increase in aortic pressure. And the ventricular volume during this phase of the isovolumic relaxation is at its lowest. The next phase is the rapid ventricular filling. So the ventricular pressure here decreases less than the atrial pressure. So during the rapid ventricular filling, where the ventricular pressure is decreased less than the atrial pressure, now the AV valve will open, and the blood from the atrium to ventricles will flow, and the aortic pressure will decrease. So the heart sounds that can be heard during the rapid ventricular filling is the ST, or the third heart sound. The third heart sound can be heard due to rapid ventricular filling, and it is normal in children but not in adults. So the ventricular volume here in rapid ventricular filling rapidly increase. For the last phase, this is what we call the reduced ventricular filling, or also known as the diastasis. This diastasis is the longest phase of the cardiac cycle, and the ventricular filling continues but at its slower rate. And diastasis, or reduced ventricular filling, this phase is dependent on heart rate. So there will decrease in HR and decreased time available for ventricular filling. So here's the picture of the graph. So in the first phase is the atrial contraction, which is preceded by P wave, and the atrial pressure, ventricular volume increases. And what we can see here in the atrial pressure curve is the A wave, and the heart sound that can be heard is the fourth heart sound. So it's not in the graph. And the next phase is the isovolumic contraction, and it begins after the onset of the QRS. And what happened here is the ventricular pressure increases but less than the aortic pressure. And with that, the semilunar valve, such as aortic and pulmonic, is still closed. The ventricular volume remains the same, and the ventricular pressure is greater than the aortic pressure. There, the AV valve, such as the mitral and tricuspid valve, will close, and the first heart sound can be heard. And the C wave can be seen in atrial pulse curve, or venous pulse curve. So here is the C wave. The next phase is the ejection, or rapid ventricular ejection, and the atrial filling begins. and the ventricular pressure increases, and which is greater than the aortic pressure. Here, the semilunar valves, which is aortic and pulmonic, will open, and the blood will flow from the left ventricle to aorta, and the ventricular volume here decreases in the rapid ventricular ejection. And that's the rapid ventricular ejection. The next one is the reduced ventricular ejection, where the ventricular pressure, the ventricular volume, as well as the aortic pressure decreases, and the isovolumic relaxation. The next phase, and the fifth one, is the isovolumic relaxation, where the repolarization of the ventricle completes, and the end of the wave. So in atrial pressure curve, the V wave can be seen, and there can be decrease in ventricular pressure, but greater than the atrial pressure. So the AV valves, just the mitral and tricuspid, are still closed, and no blood flow from atria to ventricles, and ventricular volume remains the same during the isovolumic contraction. When ventricular pressure decreases is less than the aortic pressure, the semilunar valve will close, and the heart sound that can be seen is the S2, or the second heart sounds, which is physiologic to have a S2 split, or split S2, which is what you know, the physiologic split S2 can be seen during the inspiration. And here in aortic pressure curve, the dichrotic notch and the insensura can be seen, that is during the isovolumic relaxation, which causes increase in aortic pressure. And in this stage, the ventricular volume is at its lowest. And then the next phase is the rapid ventricular filling, where the ventricular pressure is less than the atrial pressure. Here the AV valve will open, the blood flow from the atrium to ventricles will happen, and the aortic pressure here decreases, and the heart sound can be seen is the third heart sound due to rapid ventricular filling, and it is normal to children but not in adults, the rapid ventricular filling. And the ventricular volume here rapidly increases. So the ventricular volume here rapidly increases during the rapid ventricular filling. And the last phase, which is the diastasis, so this is the longest phase of the cardiac cycle, and the ventricular filling continues but at slower rate. And this reduced ventricular filling, or diastasis, decrease in HR, decrease time, and available for ventricular filling. Now let's discuss the heart sound. So we have here the four heart sound: S1, S2, and S3, as well as the S4. So S1 is the cause of this one is the closure of the AV valves, such as the mitral and the tricuspid. And we can see the S1 during the isovolumic contraction. The S2 can be split physiologically during inspiration, and this is due to the closure of the semilunar valves, such as the aortic and the pulmonic valve. And this phase can be seen during the isovolumic relaxation, the closure of the semilunar valve. And then the next heart sound is the S3, or the third heart sound. This rapidly ventricular filling, we hear during rapid ventricular filling, and this is normal in children, in young adults, pregnant, and right-sided heart sound S3 in the CHF. And then the last heart sound is the S4, where it can be found in the stiff vent, so there will be vibration in ventricular wall during systole, and this can be seen at the atrial contraction or atrial systole phase there. We have here the split S2, which is the split that occurs during inspiration, and it happens when there is increase or high blood in the right atrium and right ventricle that will delay the closure of the pulmonic valve and earlier closure of the aortic valve. So the aortic valve closes before the pulmonic valve, that causes the split S2. And we have here the common ECG finding in the paradoxical splitting of S2, where the P2 comes before the A2. This condition can be seen in patients with left bundle branch block. And another type of S2 split is the exaggeration of normal splitting, where there is wide split S2. That can be seen in right bundle branch block, pulmonary stenosis, mitral valve regurgitation, and ventricular septal defect. So we have what we call fixed splitting, This is the auscultatory hallmark for atrial septal defect, fixed bleeding. Okay, now let's discuss the murmurs and where it is can be best heard. So the aortic valve murmur can be heard together with the pulmonary valve in the second ICS. However, the aortic valve is on the right side and the pulmonary valve is on the left side. So the aortic valve can be found in the second ICS, right parasternal, and the pulmonary valve found on second ICS, left is parasternal. And the tricuspid valve and the mitral valve, which is also known as the AV valve. So the tricuspid valve can be seen in the 4th to 5th ICS, left parasternal line. However, the mitral valve can be seen in the 5th ICS, left mid-clavicular line. So that's all for our cardiac cycle.